Welcome to today's Explainer. We're jumping straight into a massive development in oncology today, a real breakthrough in treating kidney cancer using the combination of pembrolizumab and belzutifan. The speed this science is moving, it's honestly incredible. This new trial data is completely reshaping how we think about post-op cancer care. So let's get right into it.
Okay, let's dive into this. We're breaking this down into 5 clear chapters today. First, the kidney cancer challenge. Second, we'll meet our dynamic duo. Third, the LIGHTSPARK-022 trial. Fourth, we'll weigh efficacy versus toxicity. And finally, the next frontier.
Chapter 1. The Kidney Cancer Challenge.
To really grasp the stakes here, let's look at the numbers. In 2022 alone, roughly 435,000 people worldwide got a new kidney cancer diagnosis. And get this, renal cell carcinoma makes up about 85% of those cases. We're not just talking about statistics here, that's hundreds of thousands of lives, families, and communities all over the world. It perfectly highlights exactly why we need these therapeutic breakthroughs so badly.
Now, our focus today is on the adjuvant setting. Think of it like this. A patient just had a nephrectomy, meaning their kidney was surgically removed. The visible tumor? Gone. But microscopic, totally unseen cancer cells could still be lurking. Adjuvant therapy is basically the highly specialized mop-up crew that goes in after surgery. It specifically targets patients at an intermediate high or high risk of recurrence, and its whole job is to hunt down any rogue cells before the cancer can return.
All right, Chapter 2. Meet the dynamic duo. Now, what's really interesting here is how these two powerhouse drugs actually work, because they tackle the problem from completely different angles. On one hand, we've got pembrolizumab. This is an immune checkpoint inhibitor, an anti-PD-1 therapy. It basically takes the brakes off the body's own immune system so your T cells can go in and attack the cancer. On the other hand, there's belzutifan. This is a first-in-class oral HIF-2 alpha inhibitor. Instead of boosting the immune system, it directly stops the tumor from adapting to low oxygen. It literally starves the tumor of the pathways it needs to survive. So you've got an immune booster on one side and a tumor starver on the other.
Chapter 3. The LIGHTSPARK-022 trial.
This brings us to the ultimate testing ground, the LIGHTSPARK-022 trial. And wow, the scale of this Phase 3 double-blind trial is impressive. We're talking 1,841 patients. Every single one of them had a prior nephrectomy for clear cell renal cell carcinoma and was at an increased risk for recurrence. They split them right down the middle, randomized 1-to-1. 921 people got pembrolizumab plus belzutifan, and the other 920 got pembrolizumab plus a placebo. The whole point was to isolate exactly what happens when you add that HIF-2 alpha inhibitor, belzutifan, to the existing standard of care.
And this brilliantly illustrates a pretty clear victory for the combo therapy. If we look at the estimated 24-month disease-free survival, the pembrolizumab and belzutifan group hit an 80.7% survival rate. The placebo group? They were at 73.7%. That gives us a statistically significant hazard ratio of 0.72. Or, to put it simply, adding belzutifan dropped the risk of disease recurrence or death by 28% compared to just using pembrolizumab alone. That's a huge deal.
Because of that incredible data, this didn't just stay buried in some academic journal. It actually led to a massive real-world milestone. Just last month, on June 12, 2026, the FDA granted swift approval for this exact combination. Belzutifan plus pembrolizumab is now officially approved as an adjuvant treatment for adults with clear cell renal cell carcinoma who are at that intermediate, high, or high risk of recurrence post-surgery. Talk about a rapid translation from clinical trial to standard practice.
Which brings us to Chapter 4, Efficacy versus Toxicity.
So the crucial point here is that this boost in efficacy, it absolutely comes with a physical cost. When we look at grade 3 or higher toxic effects, meaning adverse events severe enough that you actually need medical intervention, the numbers are frankly sobering. 52.1% of patients on the combo experience these severe adverse events, compared to just 30.2% in the placebo group. That's a huge jump in toxicity. It shows us that aggressively starving a tumor while simultaneously revving up the immune system takes a really hard toll on the patient's body.
To add another layer of complexity to this, we have to talk about overall survival. At this specific interim analysis, which happened when only 29% of the final events were observed, the overall survival rates were basically identical. We're looking at 96.2% for the combination group and 95.7% for the placebo group. Not a statistically significant difference. So while disease-free survival spiked, the actual overall survival right now is practically the same. It perfectly captures the incredibly complex, highly personal choices patients and their doctors have to make. You're constantly weighing quality of life against the very real fear of the cancer coming back.
Chapter 5. The Next Frontier.
Let's move to and see how this builds into an even broader strategy with the ongoing LIGHTSPARK-02 study. The battle against cancer never stops, right? This is a massive, randomized, open-label Phase 3 trial, but this time it's for patients with advanced metastatic clear cell renal cell carcinoma who haven't had any prior systemic therapy. It's a huge undertaking. They're aiming to randomize over 1,600 adults worldwide to see if we can push survival rates even higher right from the absolute moment of diagnosis.
What makes LIGHTSPARK-012 so incredibly compelling is what's happening in Arm A of the trial. Right now, thanks to the CLEAR study, the standard of care for advanced disease is pembrolizumab plus lenvatinib. Well, researchers are now testing if adding belzutifan to that mix can create an even more powerful triplet therapy. Think about it. They're combining an immune checkpoint inhibitor, a targeted kinase inhibitor, and a HIF-2 alpha inhibitor, all at the exact same time. The goal is to shut down multiple oncogenic pathways all at once for unprecedented disease control.
Which brings us to the ultimate question at the heart of all this scientific progress. As we relentlessly push for higher survival rates, layering 2 or maybe even 3 powerful drugs together, how much toxicity is an acceptable trade-off for a potential cure? The data clearly shows us that greater efficacy brings a much heavier physical burden. It's a delicate, profoundly difficult balance of risk and reward that the medical community, and most importantly the patients themselves, are going to have to navigate as we chase this next frontier. Thank you so much for joining me for this explainer. I hope this deep dive gave you a much clearer understanding of the science shaping tomorrow's medicine.